Hi, my name is Judie Vankooiman, and you're watching Life Issues. October show is about Child Health Equity Center. My guests are Alison LeBlanc and Arvin Garg. Welcome, both of you.
Thank you so much.
My pleasure. Alison, I'm going to start with you. What is your professional background?
It's a really great question. So I actually have been in healthcare for about 10 years with a focus on strategic development, program management, and value-based care, and have gotten into health equity in the last 5 or so years.
Okay. And how long have you been with the center?
So I was actually recruited from Boston Medical Center to UMass Memorial to help start the center. So I've been with the center since it started and helped actually get it going. So prior to the start of the center, I was actually at UMass for about 8 months.
Oh, wow. Okay. And why was the center started?
So the center was really started because we saw a trend of a lot of programs and centers popping up related to health equity, but we didn't see a lot of focus on health equity where it starts, right? So a lot of inequities begin in childhood and then are exacerbated throughout adulthood. So we really wanted to do something specifically focused on children and families, which we didn't see a lot out there focused on that area.
Okay. And Arvin, I'm going to switch over to you. Yeah. What is your professional background?
Yes, I'm a physician. I'm a pediatrician, a general pediatrician, and went to medical school, grew up in Boston, outside Boston, went to medical school, became a pediatrician, thought I wanted to just be a clinician. And I enjoyed seeing patients, enjoying seeing families, but I really wanted to think about having a bigger impact on children and populations. And so I stumbled upon research, and my research focus really kind of resonates and aligns with health equity for children. And so that's kind of how I got my foot in the door in this world.
Working with children must be very special, working with those little ones.
It was great. I had clinic this morning. It was wonderful.
And how long have you been with the center?
Yeah, so this is an idea that Alison and I had before we even came to UMass. So really from the very beginning, it was something that she and I kind of thought about together. Then we kind of had this idea and made it become a reality. So really from the preconception even.
Okay. And what is your vision when you started it?
It's a great question. The vision is for us to improve the lives of children and families, particularly those most marginalized in our society. If you think of what are the two biggest threats to children, it's poverty, and we'll talk more about it later, but almost half of children in the United States are poor or live in low-income households. And the second is structural racism and interpersonal racism. Over half of children since 2021 are children of color. So for us, we really wanted to kind of get to the structural roots of where health disparities begin at a population level and think about what are ways we can improve these disparities through clinical partnerships with the community, as well as helping support the amazing community work that's already ongoing in this area.
Okay, great. And what is the mission of the center, Alison?
So the mission of the center is to advance child health equity locally, nationally, and internationally, particularly for those children most disadvantaged by poverty and systemic racism, through groundbreaking program and research that transforms public policy and healthcare systems.
Okay. And what are the health inadequacies?
So health inequities are really the things that cause differences in our health, well-being, and health outcomes that are considered avoidable or maybe a result of factors such as economic factors, geographic factors, race, gender. And so inequities are really not, like you might think of somebody has asthma, and somebody doesn't have asthma. So that's not necessarily health inequity. When it becomes an inequity is if you have, for example, 2 kids who have asthma, and one whose asthma is exacerbated because they're unhoused. And so because of the economic factors their family is facing, they have more detrimental health outcomes.
Okay, great. And can you please talk about promoting diversity, equity, inclusion, and belonging?
Yeah, no, we love talking about promoting diversity, equity, inclusion, and belonging in the center. We call it DEIB for short because it's a mouthful. And it's really, we try to create a center where everyone feels welcome and included. And, we try to have a lot of people with diverse perspectives, diverse experiences, because we really feel like that enriches our experience and also the work. And then the inclusion part is really making sure that people don't feel like they have to assimilate to others or be like others to feel like they belong, right? They are included in what we do. And that, when we form that within our team, we believe that we can bring that out into our program. So while we're promoting equity without, we want to make sure we're promoting equity within. And we had really strategically chosen to do a child health equity center versus equality, because equality is really giving everyone the same thing. And when you are in an unequal environment and you give everyone the same thing, you just reinforce status quo, which includes systemic racism and discrimination. And so equity allows us to give everyone what they need.
Okay. And why are programs important?
I think programs are so important because there's a lot of inequities that are facing our children, and the programs that we've designed are really around ensuring that we're addressing adverse social determinants of health, like transportation insecurity. We're improving access to the healthcare system, improving access to economic resources, improving access to food and healthy food options and education.
Okay. Arvin, please tell us what programs you do have.
Yeah, we have a whole bunch of them, thanks to Allison's leadership. Allison talked a little bit about it. One is our Food is Medicine program, where we try to make sure families have sufficient food for their children by offering them gift cards for food. We have transportation to help families get to their children's visits, both for general pediatric visit, but also for neonatal care for those premature children who are in the NICU, but their parents, their moms are weeks away at home, and trying to help take care of a child that's hospitalized is very challenging and costly for many of our families. Really excited about the mental equity work that Allison's led to really promote, ensure that every little girl who's going through this pubertic change has access to menstrual kits. Something that's not talked about often, but something that's a great inequity. And there's a lot of cultural factors as well that sometimes inhibit the discussion of this topic, and access as well. So those are a few. We do a lot of community fairs that Allison runs. She's just had one on Saturday to really learn more about the community, make sure that families in our community feel there's a safe environment, that we're not threatening as an equity center, that we listen to them, that we hear their thoughts, their desires, which then helps us spurn new programs for us to launch moving forward. So those are just a few, but there's so many more that Allison is leading, and it really comes from us identifying a problem that our either physicians or our nurses or our staff tell us about, or our community partners tell about, or our families tell us about. And then Allison gets to work with her team, which is really her right now, to make something happen, to really address it. And it's been probably the most gratifying part of the center, is to really impact the lives of the children and families that we see within our community.
Okay, great. And Arvin, what does partner with us mean?
It's a great question. I'm sure Alison can give a more eloquent answer than I can, but I think one thing we really thought about a lot when we started the center is that we didn't want to be an ivory tower where we just did research, we talked about all this stuff, we did education, but we didn't really walk the walk, or we just did the talk. So it's really to partner, and I think in medicine, oftentimes we kind of have a savior complex in the sense that we feel like we have the answers to everything. That's something that I think gets ingrained in us during medical school. I learned a lot of things during medical school, but listening to the community, listening to families, wasn't something that was really necessarily prioritized when I was in medical school many, many years ago. So partnering with us just means that we want to listen to the community, we want to listen to our partners, we want to listen to our families, We want to earn their trust, not gain their trust, but we need to earn their trust. And we want to be able to partner with them to think about what are ways that we can help elevate their ideas that they have, help support their ideas that they have, and help inform our ideas so we can do better as well. So a true partnership.
Okay, great. And Alison, can you please tell us about joining the center on the journey to health equity?
Yeah, and it's a really great question and a great segue from what Arvin was saying about partner with us. So really, our goal in this work is to bring people together. Anyone who has a stake in child health. So that includes, first and foremost, children and families, clinicians, nurses, folks in the healthcare system, folks that are in the payer community, so insurers, folks that are doing community-based work, people at public schools, private schools, charter schools, community-based organizations, because really, child health equity is a really big topic, and it's going to take a lot of us working together to solve some of these issues. And so we're asking people to partner with us and to join us in this effort, and acknowledging that we don't have all the answers, right? And so we need to work with other people to understand what already exists, what's already been tried, what ways can we be supportive, because we're not in the belief that we can solve everything alone or that we need to lead everything. Sometimes we follow, sometimes we join, sometimes we elevate. It's all about really working together in a community, creating harmony between existing programs, seeing where there might be a gap in programming, where something else could be developed, and just ongoing listening. I think our partnerships are the best part of our center, I think, and we continue to ask people every day to join our fight. And so if anyone out there is listening and interested in joining, please join us in this effort, because it's going to take all of us.
Okay, great. And what is achieving health equity?
So achieving health equity is a really big thing. I think ultimately it is removing the barriers to healthcare access and ensuring that every child has an equal opportunity to thrive. So that means, removing systemic racism. It means removing discrimination. It means empowering those families economically, ensuring people have safe places to live, adequate transportation. So there's a lot of work to do to address adverse social determinants of health, improve healthcare access, and address many of the economic and structural factors that have contributed to health inequities.
Okay.
Yeah, just to add to that, our goals to achieve health equity is that for every child has the potential to reach their optimal health. And so to do that, we have to kind of address the social circumstances that surround that child and that family, which is really critical.
Okay, thank you. And Alison, who are the affiliates?
So the affiliates are our partners. So those organizations that we work with on active programs. So we have many of the programs that Arvin mentioned are programs in partnership with an organization. So our menstrual equity program, for example, is a partnership with an organization, a lovely organization called Dignity Matters. They provide us with the menstrual products, and we're able to distribute them to our community members that are experiencing limited access to those products. And similarly, we have an affiliation with Hope and Hygiene, which is a program in Eastern Massachusetts that provides us access to hygiene products, and that's been really helpful in making sure that we have things that we can give to families that are homeless or those that don't have access to basic needs. So all of our affiliates are really those formal partners that we have programs with that we're actively engaging to promote health equity.
Okay. How do you fundraise?
I have this person right here.
That's Alison.
That's Alison. Yes, that was a key part of when we're thinking about this. I was trying to recruit Alison. I have no idea how to do that, but I know the best person to do this, and that's Miss Alison
Okay.
LeBlanc here. So Alison she does the magic.
It's hard. I mean, we're not going to
Yeah.
make it sound easy. So we do a lot of fundraising on our website. We do a peer-to-peer fundraising with events like the Rodman Ride. We do some grant writing, which is where we get a lot of sustainable funding for our program. We do individual major gift fundraising. It's a big effort, and I think child health equity is a bit of a niche for fundraising, and so we do rely on individual donors even at the small level, and you can donate through our website by clicking the donate button, and we're constantly grinding, trying to get more money for the center, and hopefully we'll get some folks that are interested in making major gifts.
Okay, great. And Arvin, can people volunteer?
Absolutely, absolutely. Yeah, we're a very small but mighty group, and we love to have volunteers to help support the work, to also give back, to find meaning, to find purpose, and to make a contribution. So you can go on our website to enlist, and we'd love to have anyone join us.
What are some of the volunteer opportunities that you have?
That's a great question. I think the volunteer opportunities will come from with having volunteers, to be honest. We're doing so much work that's led by Alison in the community that, she runs the website. We can have blogs that volunteers can write. My daughter just wrote one recently on food insecurity. There's also volunteer opportunities in the community, working with our community agencies, our community partners, to have a volunteer from the Health Equity Center help our partner organizations. I think it's really critical. Attending community fairs with us at the in the community with the center would be really helpful as well. Putting these menstrual kits together, storing our various activities, our various materials that we have, soup to nuts. So whatever
A lot of things.
Yes,
Okay.
whatever volunteer wants to get.
Any volunteer we will accept, and we've had volunteers from. We've got a group of grandmas who volunteer for us and help get us books that we distribute in the community, and then we also have high schoolers and everyone in between. So whether you're a high schooler or a grandma or grandpa, or anyone who wants to help, we really try to create volunteer opportunities that are enriching for people that meet their needs. We know, not everyone can come out to Worcester. There's other ways to help if you're not able to come out to Worcester. There's doing a fundraiser. There's, collecting books that we can distribute. There's all sorts of things. There's web content things. So if you're ever interested in helping at all, it can be a short-term engagement, a long-term engagement. I have the most fun with our volunteers because they're all so sweet and they bring so much enthusiasm, and they really just are in it for their absolute commitment to children and families.
Okay, great. And Arvin, how many children in the U.S. live in poverty?
Yeah, it's a great question. So currently there are about 10 million children who live under the federal poverty level, which for a family of four, it's about $40,000 or so to live. And you can imagine living in Boston, living in Winthrop, living in other parts of the country, even around Boston, it costs a lot more than $40,000 for a family of four to even make ends meet. So if you use the definition of low income, which is twice the federal poverty level, it's about 2 in 5 children in the U.S. Are poor. If you look in Worcester specifically, over half of children live in a low income household. And what's been really kind of troubling but timely at the same time is that during the pandemic, during a time when families were losing their jobs, when we saw horrific lines for food pantries, because of the government investment in children and families, where we invested in a child tax credit, where every child less than 5 for a family got $3,600, for over 5, $3,000. Because of eviction moratoriums, because of increased unemployment rate, unemployment benefits, as well as SNAP benefits for food. We actually saw the poverty rate decrease by half during that time period. But because of politics, because of the lack of will, the lack of a voice for children to advocate, that those programs expired after a year, and after that, the poverty rate doubled. So we have the will, we know what to do to eradicate child poverty. Many other countries in the world have done that. When you look at investment in children and families compared to our counterparts across the world, we invest the least amount. And that's a whole long story, but basically there's far too many children who are poor in our country, who are poor in our backyard, and we have solutions to eradicate it. And one of our goals for our center is to help support those programs to address it.
Okay, great. Alison, if anyone has any questions, can you give us your contact info, please?
Yeah, sure. I'm always on email, so my contact info is alison.leblanc@umassmemorial.org.
Okay, great. And Arvin, can you give us your contact info?
Yes, absolutely. So probably the best way is my email as well. So it's Arvin, ARVIN, .garg, G-A-R-G, @umassmemorial.org. Yeah, you can email me or email Alison or reach out on our website, and we'd be happy to connect.
Yeah, if you forget the emails, our website is childhealthequitycenter.org, and you can link to contact us right on the website.
Okay, great. I'm sorry, but that's all the time that we have. Thank you both for all you do for those in need. I'd love to hear your thoughts and suggestions. Please send them to lifeissuestv@gmail.com. And remember, live each day to the fullest and celebrate life. Hi, my name is Judie Vankooiman. I'm the founder and president of Those Who Can for Those in Need.
And I'm Sebastian Lemieux. I'm the treasurer.
We connect people and resources from the greater Boston and North Shore area.
We provide help with elderly, losing a loved one, children, low income, homelessness, mental illness, disease and health issues, substance abuse, domestic violence, LGBTQ, and veterans.
We are Winthrop-based, but like we mentioned earlier, we cover a large area.
Our website is twctin.org, and on there you can find the various resources from the organizations that are with us, past episodes of Life Issues, which is a resource show, and our newsletters.
We hold 2 major events every year. We have our annual comedy show fundraiser in the spring, and early September we have our annual Family Resource Fair. For both events, please check out our website and social media sites like Facebook, Twitter, LinkedIn, and Instagram.
During our resource fair, our visitors will be able to visit the resource tables, there's food, and also various family activities.
To end, I started Those Who Can for Those in Need in memory of my husband, who passed away in 2007 of cancer. You can go on our website to learn more, twctin.org.
Thank you.